Hi, welcome to Metaboliq. I'm your host, Dr. van den Hoven, and this is the podcast where we bridge clinical research and practical insights to help you build your longevity, elevate your performance, and unleash your life force. And I'm really stoked to finally launch my own podcast. To be brutally honest, I've been considering doing this, or I should better say dreaming of doing this for quite some years now, but I've never really taken the leap. Well, until now, I guess. So here we go. But before we dive into the meat of the matter, let me introduce myself. I'm Andor van den Hoven, also known as Dr. van den Hoven, and as you can hear by my accent, I'm Dutch from the Netherlands. And I was trained as a medical doctor, specifically in radiology and nuclear medicine. I'm also a clinical researcher and a clinical epidemiologist, which basically means that I have spent a lot of time learning how to conduct clinical research and how to assess it. But you can basically summarize it as I'm a nerd. And if you look up my resume, you probably won't find that I'm also a passionate hybrid athlete. So I love doing CrossFit workouts, high rocks, go for a run, or do zone 2 trainings on a bike, high intensity interval trainings. And I'm also a lifelong learner. So I spend a lot of time not only thinking about all of the analytical stuff related to health, specifically physical health, but I also spend a lot of time thinking about what it actually means to live a good life and how you can get the most out of it. I will emphasize both of these aspects in the podcast. Now, you might ask yourself, a nuclear radiologist, what actually is that? I mean, what does a radiologist do? What does a nuclear medicine physician do? Well, basically, we assess medical images and we use imaging to guide treatment. And I've had the privilege of studying more than 20,000 people from the inside through several types of medical imaging. From x-rays to ultrasound, CT scans, MRIs, but also those related to nuclear medicine using radiopharmaceuticals with gamma ray scintigraphy, SPECT-CT, and PET-CT. And so I'm basically always assessing anatomy and function. So I am an expert in how the body should look and work, how the structure should be within all the organ systems, but also on function. So how should they cooperate physiologically? And it's always a very intriguing puzzle to get a scan of a patient from another physician who basically asks us to help create a fitting diagnosis, or maybe help guide treatment, assess treatment response. And in adjunct to all of this diagnostic work, I also specialized in treating patients with radioactive drugs. So basically irradiating disease from the inside very specifically in a targeted way. Mostly in patients with metastatic cancer. And I really love my work. And as a radiologist and in nuclear medicine, you have a very central role in the hospital. So we work with all other specialties, most of them, including surgery, cardiothoracic surgery, cardiology, neurology, pediatricians, you name it. And so we basically not only have to assess medical imaging and know a lot about the diagnostic process, but we also need to learn more and more about what the other specialists are struggling with in their diagnosis. So I'm very broadly trained as a generalist, but also as a specialist. In the beginning, when I was starting my residency, I mostly look at things the way I was trained, like is something abnormal or normal? And are findings relevant to the clinical question? If yes, then I had to describe it, check the box and move on. But gradually I learned that the human body doesn't necessarily look like textbooks. A lot of people, the majority of people, have abnormalities that don't quite fit a disease category yet. And so as the years passed, something started to gnaw at me. I began seeing patterns that didn't really fit the story that we tell ourselves about health. Scans that were read as normal for the specific diagnostic question looked anything but healthy as a whole. And abnormalities that were routinely noted as incidental findings because they fell outside the medical framework where we can actually do something with those findings were largely ignored. And one of those findings keep coming back: fatty liver disease. And at first, just like all of the other radiologists, I was trained to just describe it, but don't problematize it. Sometimes internal medicine specialists, for example, requested an ultrasound because liver enzymes looked abnormal in the blood, were elevated, and then they wanted to know whether someone had fatty liver disease or whether a drug was the cause of those elevated liver enzymes. But aside from that, it hardly ever seemed relevant until I got to dive deeper into the topic. But before I can explain that in a good way, I have to take you back more than 10 years ago. So around 2015, I did the last part of my PhD at Stanford in Palo Alto, California. And it was a fantastic time. I learned so much over there. Interestingly, I overheard a couple of guys talking about a podcast, and I had never listened to a podcast. I didn't even know what the concept was, but I Googled it, and I read that it was a long format audio product where people basically have long conversations. And my first response was, why would anybody want to listen to that? Like people rambling on about their life. It seemed so irrelevant and uninteresting to me at that moment. So life continued, and eventually I moved back to the Netherlands to start my residency in radiology. And a couple of months later, my brother-in-law actually told me he was listening to a podcast, the Tim Ferriss Show. And I thought, okay, he's a bit like me. We have some similar interests, so maybe I should give it a try. And Willard, shout out. Thanks, man. This changed my life. Literally, I started listening to the Tim Ferriss show, and then also a lot of other podcasts. Basically, every spare moment I had, every bit of free time. So on my commute to the hospital and back, even in the gym when I was doing some low, moderate intensity workout, while cooking. And one day, Tim Ferriss had a really, really interesting guest, and that was Peter Attia. And once I listened to his podcast, The Drive, and I got to peek into the brains of several experts in the world on the topic of longevity and cardiovascular health and metabolic health, this entire world opened up to me. I learned so much from that podcast and from obviously all of his writings, the newsletters, the blogs, his book eventually, I would also recommend. And I learned much more about health and longevity from that podcast and all of the guests that I got to know, like Andrew Huberman and Rhonda Patrick. And one of the topics that I found the most fascinating was that of metabolic health and how insulin signaling and insulin resistance and visceral fat affects metabolic health and overall health and the risk of obtaining a chronic disease. And from that, I basically created a framework in my mind about what it means to build your longevity, your metabolic health, your fitness, how to prevent chronic diseases, but also on the positive side, how to strengthen your health and resilience, and how to improve your health span and your quality of life. Suddenly, in the clinic, the puzzle pieces fell into place. It wasn't only from the literature that I was reading, but also the scans that I saw every single day. I mean, 1 out of 3 people in the Netherlands who get an ultrasound, for example, have fatty liver disease. And to bust the first myth, they are not all overweight or obese. So lean people can also have fatty liver disease. Fatty liver disease also turned out to rarely be an isolated finding. It was more of a signal that multiple systems had been under pressure for a long time. So a lot of people not only have fatty liver disease, but they also have a degree of sarcopenia, so muscle loss. They might have some excess fat storage in the pancreas. They can have atherosclerotic disease and so on. And that realization brought doubt along with it. Because if this is true, if the system is already failing ahead of a major health event that establishes some kind of diagnosis of, for example, heart disease or cancer, then we are structurally intervening way too late. And modern medicine is exceptionally good at taking care of those who have an acute disease or acute problem and treating clear-cut chronic diseases. But it still often thinks in binaries of being sick or not sick. And there's this basic assumption that you are healthy until one day you are diseased. And that's just so much nonsense. I mean, I understand why we think this way, because we need scientific evidence to guide us in how we should treat people. And we only have that evidence for clear-cut diseases and not for gradual health decline. Whereas health does behave like a continuous process. It's a system that can compensate for a long, long time before someone finally falls ill. And this tension became increasingly clear in my daily work. I studied more than 20,000 people, patients from the inside. And for example, on FDG PET CTs, I saw the end game of disease when it can be almost too late to intervene. But on earlier scans, the first changes were oftentimes already visible in those patients. And without ever leading to a conversation with the caregiver or the patient, how we could intervene early and how we could support that patient in becoming healthier and focusing on increasing the strength of their own health, let alone that someone reached out and took responsibility to help a patient with an actionable plan. And eventually I decided to do something about it. I love my job. I still do. It's a really interesting puzzle, and I love working with fantastic colleagues that I work with. I also love the hospital. I love the general practitioner's office. I'm really proud of modern medicine and how far we have come. But I didn't only want to help people that were already ill. So I decided to do something about it and try to help people improve their own health. That's not because I turned against medicine. On the contrary, I started to realize that both truths have to exist simultaneously. The current medical model works within certain limits. However, it largely ignores the phase where the body is already starting to derail, and we have to do something about that. Healthcare costs are rising. People are falling ill earlier and earlier. We live longer, but we live longer in poorer health. And if you just start to think about the staggering loss of quality of life, all of the pain and the suffering that people have to endure because their health is rapidly declining, then I just think we really, really have to do everything we can to change that. And at first I started a company where I help people gaining insight into their current health state, because I saw that a lot of people started to have doubts about how healthy am I actually at this moment. I assume everything is in order, but I'm not really sure. I have some vague complaints. I'm a bit tired. I have this loss of energy. I don't always sleep very well. And so I help them gain insight through blood work and extensive conversations where I learned how they felt, what their lifestyle looked like. And then I help these people to improve their own lifestyle, and through that process, improve their health. But now I want to share everything that I've learned so far with a larger audience, and that's why I'm starting a podcast called Metaboliq. It's an attempt to bridge from the inside out, connecting the on one side the established medical order with the growing group of critics who are rightly asking questions about prevention and lifestyle. And to me, the core of that bridge is very simple. Health is not a state. It doesn't work like an on-off switch. It's a trainable system, but that means we do have to train it. And when I look at all of the health content that's out there, which is growing, I mean, you only have to look on social media. Lots of influencers are sharing health advice. I see content that often fits into one of two buckets. The bucket of anti data, the just listen to your gut kind of content, and then the data without context, the numbers without meaning, people only sharing scientific papers without really helping people to integrate new insights into their routine and lifestyle. And I really didn't recognize myself in either of these buckets. So I think measuring can be very valuable, like doing blood work, but you have to understand what the body is trying to do, and you have to also understand how the results of those measures impact your health and how you can utilize them. So in this podcast, I want to do things a little bit differently. Many podcasts explain certain conclusions, like research shows that you should do X, Y, or Z, or give advice. This is what you must do. But in this podcast, Metaboliq, I want to do something else. I want to make the medical thought process audible. What data is out there in the peer-reviewed scientific literature? And what do we know in terms of physiology, mechanisms of disease, also from clinical practice? And how can we integrate those two? So that will also include uncertainty. We have some certainty about several things, but we have so much uncertainty about what is better in certain situations. And a lot of scientific evidence is group-based, whereas advice is inherently directed at an individual. So I think communicating uncertainty and doubt within certain boundaries is very, very helpful because it illustrates trade-offs. And I'm not going to give you straight up answers, but I will show you how I arrive at my own answers, and thereby teach you how to think in this way. And every episode from Metaboliq, where I explain health-related topics, will center around the Metaboliq 3M framework. The first M stands for the myth. And here I will explain to you the mainstream lie or the oversimplification that we're sold. And the second M is for mechanism. And here we will dive deep into all of the required details to get a good grip on this topic. So the actual physiology and what scientific and clinical data and of course scans, medical imaging scans in clinical practice really show us. And then the method is the last M, where we complete the circle, and I will show you concrete protocols to train your health system in your own life and how to apply all of the new insights. So it won't be simple fixes. I will just teach you how to look, think, and weigh options in a better way. And this is basically what I'm going to do with the podcast, at least in the first season. We will lay down the foundation of major health topics. And then in later seasons, I will add conversations with really interesting experts in various fields. And I hope you are already looking forward to that. I certainly do. I just want you to think of one thing before I leave you. What we often call normal has in many cases been dysregulated for years. Have you also come to this insight, and have you thought about how we could interrupt this cycle? Then this podcast really is your thing. It's for professionals who recognize that and are willing to look earlier and broader without betraying their craft. And, of course, for all the fellow health nerds out there who want to optimize their own health. All right, I'll see you in the next episode.